as I was saying, Associate Professor of Pediatrics at the University of Michigan. I focus on pediatric endocrinology. I work with kids and families with mostly type 1 diabetes at Mott Children's Hospital. And you know, I kind of participate, I guess, as a member of a community online in Twitter. I am at Joyce Lee, so at Joyclee. That's what's Joyce without the E. And I identify as doctor as designer because I'm very passionate about design thinking, and as it's a really important tool for thinking about how we can really think about patients as partners in the creation of healthcare systems that are more effective and produce better outcomes for all players in the health system. So I spend a lot of time on Twitter. I guess I'm up to 18,900 tweets. And so, so one of the things that I wanted to say before sort of jumping into our analyses was just that there is a robust diabetes community online, and I think they call themselves the DOC, and actually some of them are actually here in the room right now, so thanks for coming. Yeah. So, you know, it's people participating in Facebook, it's people participating in Twitter, it's communities of people that have formed organizations for advocacy, whether that's online or offline, you know, repositories for information, for sharing, there's blogs, right? So, and I really, really encourage my fellow healthcare professionals to be online. I think there's a lot of fear about social media, but I really feel that it's an important tool for us to understand the patient experience, because a lot of really wonderful information is being shared that we should be listening to and that we should be learning from. So I love this example. So I follow Carrie Sparling on Twitter. She's 6 Until Me, and you know, this is a mobile health technology conference, right? So you think that the next impressive mobile application for diabetes would be some newfangled app that does all sorts of things, like maybe measures your food or the carbs in your food, right? But I think this is a really great, simple example of mobile technology. So some patients wear this thing called the continuous glucose sensing monitor. And so what it does is it measures glucose every 5 minutes using interstitial glucose. And it alarms when you go low or when you trend high. And a lot of people actually can't hear the alarms because they're not loud enough, so they don't actually wake them up in the middle of the night, which would be really important if you're going to experience a low in the middle of the night. So I thought this was the coolest thing that I never would have learned if I had not been listening, I guess, to a community that's sharing information and sharing useful information. So what some people do, what Carrie shared, was that what you can do is you can take the transmitter, right, which vibrates, you can stick it inside a glass, right, and you can stick it on your night table. And then you grab the iSeismometer app, which is an earthquake detection app off of the App Store, right? And then when this thing vibrates, right, then the iSeismometer app alarms. So like, to me, that's like incredible, creative, mobile technology at work, patient created, right, that the dumb provider, the dumb clinician never would have known about had one not been sort of lurking online, okay? But in any case, I just wanted to highlight some of the people that are participating today. You know, I follow those guys over there. But as well, you know, Doug Cantor, you know, who does really interesting data visualizations of his diabetes data. Dana, who's been working on her own do-it-yourself artificial pancreas, which you could probably hear about later this afternoon. The whole We Are Not Waiting movement, which is a community of people in the diabetes community who really want access to their data and are working for that very, very, very ferociously and in a really impactful way through this thing called Night Scout and CGM in the cloud. And I just also want to acknowledge Howard Look and his community for, you know, trying to build an open source data platform to integrate all of the different devices that our patients use to have access to their data and integrated views of their data. And then one other thing, so there's something called Diabetes Social Med, or DSMA. So DSMA is one of the hashtags that sort of forms the community, right? It's a hashtag that a lot of people use in the community. And for example, there's a tweet chat that happens every week at a certain time with using that hashtag. And Charisse, who runs it, had this question: what do you wish your healthcare provider or your device manufacturer knew about the DOC? And I think this is a very telling statement. Like, I get more info from the DOC than I get from the DOC, right? So, kind of keep that in mind. Healthcare professionals, medical providers, people who are not patients, like, we need to listen, learn, and lurk from our patient communities. So I think, I've made the case, I guess, for personal reasons, for professional reasons, why I like to use Twitter. And so we wanted to, I'm a health services researcher by trade, so we do a lot of analyses looking at health outcomes, and we look at hospitalizations and we look at hemoglobin A1C, right? But I think, the big missing piece to the clinical data is this other patient-reported data, and social media is a form of patient-reported data that I think researchers need to leverage more in their understanding of disease and its determinants, right? I would say the diabetes community, I don't know if you guys agree, but they're probably like one of the most advanced communities online. Like, it's just, there's a huge force happening online, and there's a lot of people participating. But when I went back to the literature to actually find studies, like formal studies in the literature of the network, I actually couldn't find much of anything. So that's why we wanted to do this study. So what we wanted to do was identify a community of individuals on Twitter. And Twitter it's one big mass of individuals, right? Maybe there's a lot of kind of invisible accounts too, but how do you identify a community? And we thought what we'd do is we take the approach of identifying a community based on a hashtag, right? That's sort of one way of approaching it. It may not be the only way, but that's the way we thought about doing it, right? And so we wanted to use either key diabetes-related terms and hashtags to identify diabetes-related tweets, and then the frequency with which the tweets were used across the different terms and hashtags. So warning to my fellow tweeters, like, this is preliminary data. I was literally like doing some analyses this morning. So, working more with a graduate student back at University of Michigan to basically polish this up and actually turn it into a polished form, into a paper, but also wanting a lot of input from other individuals, particularly the diabetes community, about what questions you might have and what questions we might be able to answer with the type of data that we have. So just take it with a grain of salt, but at least you get a sense of the type of data that we can capture. So University of Michigan is lucky in that it has actually a contract with Twitter, so they actually have 10% of all tweets ever tweeted in their repository. And so what we decided to do was focus on just the calendar year 2013, and I came up with some terms, right? So the terms were sort of just free text, right? Glucose, blood glucose, diabetes, insulin pump, insulin, right? And then obviously there are hashtags that are that we also chose. So diabetes, I guess, is an obvious one. DSMA, we just talked about. DOC, we talked about. BG Now is an interesting hashtag that people use to just report on their blood sugar sort of in the moment on Twitter. And so then we tried to capture some other hashtags related to diabetes. And so the information we could extract from these tweets were content, the Twitter username, date and time, geolocation if it's available for the tweet, and then whether there was a retweet. We do have IRB approval from the University of Michigan School of Information, but we can't present any identifying data. So this is all public data. Like, you could go back into Twitter, you could do a search, you could find it, but we're not allowed to sort of reveal the users' identities. We're really supposed to talk about the group in aggregate. And one of the things that we tried to do was just try and understand who are the players or who are the individuals within a defined community. So we did that particularly for hashtag DSMA, and we used Mechanical Turk to be able to do this literally in the last 48 hours. So love technology. So in terms of our results, there were 623,481 tweets that had one of those tag words, right? So it could have been diabetes, could have been insulin, could have been any of the hashtags, right? There were 209,000 retweets, and then the number of retweets that have geolocation information is obviously a lot smaller, around 2%. I hope you can see this. So this is just the number of tweets and sort of decreasing frequency using these different hashtags. So these are not exclusive, right? So there could be tweets that use diabetes and insulin, or glucose and blood glucose, or glucose and hashtag T1D, but this is just for a given hashtag, how many tweets were there that use that hashtag or that keyword. So diabetes obviously sits at the top, and then it goes down insulin, glucose. DOC and DSMA are quite high up there, and then there's this goes in descending order. Questions, thoughts? Yeah. Okay.
Oh, I'm eating like a huge piece of cake. That all the time. So
Yeah.
let's give you your results.
So I think that's why we try to do a sub-analysis with DSMA. Yeah, there's a lot of junk in the social media, right? And just by the sheer number of tweets and the number of individuals that you try and capture it from, the word diabetes does bring up all the. I mean, there's a lot of promotional things, right? There's a lot of like marketing happening. So it is a little bit I guess imprecise, and that's why I tried to target a community that I actually know, right? So I just want to highlight DSMA, there were 5,498 tweets. But the one thing I want to mention again, this is 10% of tweets, right? So this is not all of tweets. So I guess you could theoretically multiply that by 10, but that doesn't necessarily mean that there's more users, right? Because this would just be sort of a cross-section of the people who happen to tweet at a certain frequency. And then this is just an example of among DSMA users and among all users, the number of tweets versus the number of users that actually use geotagging, right? So of that big mass of individuals and tweets, this is actually the discrete numbers of people that geotag. And we did a comparison just to see, so we looked at whether, sorry, this is not all users. This should say the diabetes, right? The diabetes terms, right? So about 2.5% geotagged, and that was actually not different than a totally random sample of Twitter users, right? So overall, regardless of diabetes, around 3% of people geotag their tweets, okay? And so there was a significant difference between those, but there actually wasn't a significant difference between DSMA and all users. But you can see the numbers are really small, so. All right, and then this is a heat map of tweets, and this starts with January, and then we're just going to walk through to December, and these are kind of cumulative, right? So no tweets are going away. This is not a minute to minute. This is sort of overall what's cumulative happening throughout the year. There's probably some mistagging because you're going to see some tweets happen in the middle of the ocean. Okay, but this is kind of what it looks like, and I don't know if anyone has observations. I mean, I think the North America component is obviously quite noticeable, but I think it's sort of an interesting thing to see. In terms of the actual, what does the red mean, how much of a density that is, I have to go back to the graduate student to give me that information, because this is sort of another app that one of his fellow students is using to create this kind of imagery, and he didn't have that information about what the density really means. Okay, so then this is tweets for the entire year. This is all of the diabetes tweets, and you can see some spikes, right? So this was Christina Kirchner in March 2013 posting a tweet saying that diabetes is a disease of affluent people. Okay, this is City of Hope fundraising for cancer and diabetes, and news about type 2 diabetes, mortality rates going down. Here we have Nick Jonas winning at Teen Choice 2013 for recognizing his efforts to help find a cure for diabetes with the Change for the Children Foundation. And then the biggest spike you see here is World Diabetes Day, right? All right, so this is where the Turkers tried to help us understand who's in a community, and this I really focused just on hashtag DSMA, just for the reasons that you mentioned, Kim. So I think, so a couple things. So you could have been mutually in two different categories, right? Because you could be a provider, but you could also be a patient with type 1, or you could be a provider, you could be a patient with type 2. So we tried to, so some of these obviously repeat, right? These are this is someone who's type 1 and who's actually at a diabetes company, right? But I think what's, interesting, I don't know what you guys think, I'd be curious to see what you think, but type 1 is what, 23, 24% of the users. There was a total of around there was a whole around 826. We only got to do about half, so we're gonna have to go back and do the rest. So we only have like 391, but assuming that's a representative sample, right? So mostly type 1, a little bit of type 2, 2%, unknown diabetes, 9%, and then I think what's really telling is healthcare researchers, 2% doctor, 1% nurse, 1%. So like total absence of healthcare providers in that conversation, which may be appropriate, but also, you know, I think says something to me as a physician who's trying to get my colleagues to be more empathetic and to learn more about what's happening on social media online. Okay, yeah, that's fine. I'm done. Okay, so limitations with 10% of tweets, like you can't visualize the network. I had the students visualize the network and it's just like a big mush ball, right? Like, so I didn't even want to show it because it's not going to tell us anything. You know, it'd be interesting to look at year-to-year data over time. Like, so this is 2013, but maybe 2014 we can run it again. And like we were saying before, there's lots of undefined users in the community. Future questions I have are, one, we actually have to, you know, confirm these findings. I'm curious about what questions the community has. You know, I don't know that I picked the right hashtags. Maybe there's many other hashtags that I should be considering that we can redo the analyses with. We want to do some network analysis with sort of subgroups of individuals so that we are not waiting movement, like we're actually trying to just track all of those tweets to figure out who's in that network and who's tweeting about it. And then we also have the option to do some sentiment analysis, and we just didn't have time to get to that yet by this presentation. But, you know, so there's sort of scales that exist that allow you to look at positive and negative sentiment, anger, sadness, and so those are some things that we want to look at as well for the population. So I will end with my tweet that says the biggest risk of social media in healthcare is not using it all. And I also want to make a plug for Health Design by Us, which I'll be presenting in the next room in a couple of minutes. This is a collaborative innovation network of individuals who are really interested in patient-centered participatory design, creating a culture of making health, and kind of bringing together people to share resources, tools, and technologies so that we can all get to the healthcare we need faster and in a more accelerated fashion. So happy to take questions. Thanks very much for your time.